Welcome friends on MuniMeterHealth, your source of learning about human heart and cardiology. We are enhancing medical education, patient education continuously every step of the way to improve the clinical outcomes. What are ACE inhibitors? We shall be discussing very briefly during this talk. ACE inhibitors are essentially drugs or pharmaceutical agents that are prescribed by your internist or cardiologist to treat high blood pressure and congestive heart failure, which is CHF, hypertension or congestive heart failure. It may also be prescribed to treat in the process of healing myocardial infarction or heart attack, we call it. Heart attack, we'll write it down for you here. And of course, also to prevent the further complications of diabetes, kidney diseases. Remember that. So these are the two later indications, but hypertension and heart failure, this is where they're commonly prescribed, these ACE inhibitors. ACE inhibitors. So what is ACE? Let's understand that. That's an enzyme that's normally present in your body. It's called angiotensin converting enzyme. Nice word, a nice acronym, ACE. And what does it do? It converts angiotensin 1, which is an inactive form. Remember, this is inactive, to an active form, angiotensin 2. Angiotensin 1 is present in the lungs. So this is the active form which is present throughout your body. Now, obviously, angiotensin 2, if it's present in the body, it's meant for some purpose, right? So basically, it has two main purposes. One, it causes vasoconstriction. By the way, there's no vasoconstrictor more powerful than angiotensin 2. I got some news for you, okay? So vasoconstriction, it is basically causing the arterioles to become more narrow by the action of angiotensin 2. So remember, for blood pressure, we need vasoconstriction because that's where the peripheral vascular resistance resides. It resides in the arterioles right here. So if the more the narrowing, the more the vasoconstriction, the higher will be the PVR and therefore higher will be the blood pressure. You can maintain a blood pressure there. So it's required in the body to have some blood pressure, just like we need some level of pressure in order to have water in your faucets, the same way. So angiotensin 2, the second function is sodium retention and water retention. Remember, along with the sodium comes the water anyway. So this is the action on the kidneys and this is where it works. So both will be retained, and as a result, sometimes in weaker hearts, patients who have tendency for heart failure, it can result into congestive heart failure. So mind you, hypertension and heart failure both can be resulting as a result of ACE enzyme, which is present in the body and converting and helping convert angiotensin 2. Now, if you have an angiotensin converting inhibitor, like if you have an ACE inhibitor, which we'll give you an example shortly, if you have an ACE inhibition, then what happens is you're blocking the action of ACE, converting the angiotensin 1 to angiotensin 2. So now you have a block. The moment you produce a block right here, there's nothing that's happening, in other words, beyond this action. So angiotensin 2 will be lessened or not be present, and as a result, there won't be any vasoconstriction, there won't be any sodium retention, there won't be any water retention, and therefore hypertension can be managed and heart failure be managed. Okay, because those are the major issues that result from higher amounts of ACE, if you will. So ACE inhibition is a wonderful, wonderful method by which hypertension and heart failure has been treated now for decades. The first example that came out was captopril. They all end in prils, by the way, so just quickly I'm writing these. Captopril, then came the enalapril, then came the ramipril, then came the lisinopril, and they all have been life-saving and life-prolonging drugs, rather, I should say, and the list goes on. So there are numerous, and quinapril, and you name it. So all these prils, so-called, were ACE inhibitors. So these are the agents which are now currently prescribed by your cardiologist and internist. So feel free and discuss that with your physicians and, of course, with your medical community. So this way you have a better idea as to now, next time when you make a doctor or clinic visit, ACE inhibition, you have a better handle on the information. Okay? So looking forward to seeing you again on MuniMeterHealth. Hope you enjoyed this session and looking forward to talking about something more interesting.